Hi everyone! Today we will be talking about Huntington's disease. Huntington's disease is a rare autosomal dominant neurodegenerative disease. This means that if you have Huntington's disease, you will have a 50% chance of passing this disease down to your children. So how do you know if you have Huntington's disease? There is a mutation in the Huntington gene that is located on chromosome 4. A healthy gene contains a repetition of the trinucleotide CAG anywhere from 3 to 35 times. In the Huntington gene, this trinucleotide repeats 36 or more times. If you have this mutation, you begin to see symptoms around the ages 30 to 50 years old. This disease affects 3 to 7 out of every 100,000 people, so it is very rare. So how do you know if you have Huntington's disease? There are 3 types of symptoms that could appear: physical, cognitive, and emotional. Some of these physical symptoms include chorea, which is the inability to control movement, slurred speech, and loss of balance. The cognitive symptoms include memory loss and difficulty completing and learning easy day-to-day tasks. The emotional symptoms may include depression, anxiety, mood swings, and changes in personality. This is all because of the degradation of neurons in certain brain areas due to the mutation of the Huntington gene. The basal ganglia is a structure in the brain that is responsible for controlling motor movements. When this structure is affected, symptoms like chorea will appear and worsen as it gets smaller. In a normal brain, you can see what size the ventricles in the basal ganglia should be. In a brain with Huntington's disease, the lateral ventricles become very enlarged and the basal ganglia is very small. The degradation of these areas causes motor impairments. There is currently no cure for Huntington's disease, but there are things we can do to manage symptoms. Drug treatments such as tetrabenazine and physical therapy can help minimize motor impairments from this disease. There is also occupational therapy that improves independence by helping you carry out day-to-day activities. It is important to note that if you are experiencing any of the symptoms for Huntington's disease, please contact your doctor. If someone you know has been diagnosed with Huntington's disease, patience, communication, and encouragement are 3 things that you can practice to be as supportive as you can. Thank you for watching.